Hey, this is Chris Dewey with May River Medicare, and today I've got some positive news in a world filled with negativity, especially with Medicare lately, with all the negative press on United Healthcare, Humana, Aetna, Elevance, all these companies in big trouble, being investigated by the Department of Justice. I got a little nugget of positivity for you. Huge announcement about a week and a half ago. President Trump and Medicare, Center for Medicare Services, just announced a massive 7.2% payment increase for Medicare Advantage plans for the insurers that offer those in 2026. That's the largest hike in years and is significantly above the prior expectations. As well, for 2025, government payments to Medicare was going to increase 2.3%. That's gone up to 5.2%. So what does it mean? Companies like United Healthcare, Humana, CVS, Aetna, WellCare, they stand to benefit big time. There's also a chance we can expect ripple down effects in the form of better Medicare Advantage plan designs, lower maximum out-of-pockets, lower out-of-pocket costs, and more robust, rich benefits like more dental and vision and things like that. Because, guys, Medicare's, they're going to give them additional $35 billion in additional money in 2026. Now, here's a negative twist to it. These private insurance companies are under investigation by the Department of Justice. This has been going on since 2022. The Office of Inspector General, the Budget Office, Department of Justice, Medicare. So real quick summary of what they're being investigated for. There's one thing is upcoding, when an insurance company entices a doctor to intentionally misdiagnose a patient with a fictitious chronic condition to trigger higher monthly payments per enrollee from Medicare to the insurance company. Now, improper use of prior authorizations and denials, another big red flag that the Justice Department has been investigating since 2022. And lastly, the three major call centers that they pose as Medicare with the red, white, and blue commercials. They have paid these call centers, insurance companies have paid them tens of millions of dollars in kickbacks to steer beneficiaries into a plan that's advantageous to the insurance company, but not the prospective client. So, or even worse, the plan that's right for the client, these call centers will go out of their way to keep them away from the plan that fits them and put you into a plan that fits the insurance company. So in order to understand how this massive increase in spending could positively impact next year's Advantage Plan benefits, maybe some reduction in out-of-pocket costs, and more robust dental and vision, let me explain, let me drill into your head the biggest nugget of information that may help you decide whether to stick with traditional Medicare with a supplement versus going down the managed care Advantage Plan pathway. So the biggest lie propagated by Medicare Advantage Plan insurers, the giant call centers, the political actions committees and lobbyists, and again, these are call centers that are dressing up as if they are actually Medicare, okay? And these lobbyists pay billions of dollars over the years on TV ads preaching that Medicare Advantage is the same as Medicare. Let me be clear, Medicare Advantage is nothing like traditional Medicare. Anyone telling you this has their own self-interest in mind. Secondly, Medicare Advantage, the second biggest lie is Medicare Advantage must offer at least the same benefits and coverage as original Medicare. This is blatantly false. First is when you publicly fund a for-profit corporation with stockholders, you have a conflict of interest, meaning on the one hand, you have to effectively manage the care of seniors and folks on disability and provide credible coverage that's cost effective. But on the other hand, you have stockholder meetings and shareholders to answer to. You have quarterly board meetings and earnings calls. So corporations' sole goal in life is to make money, increase profit margins, so the CEO can get his well-deserved raise and guarantee the stock options are going to go up each year as the price of, say, UHC rises from the ashes of its recent downward spiral. But does the primary purpose of these private corporations conflict with their secondary purpose, which is to deliver quality health care to seniors that have paid their whole lives for this? So in order to understand how this massive increase in spending could positively impact next year's Advantage Plan benefits and possibly reduce out-of-pocket costs, let me explain. No, let me drill into your head. The biggest lie propagated by Advantage Plan insurers, giant call centers that are posing as Medicare. You got the red, white, and blue colors telling you that they're independent and that they're going to help you find a plan based on your needs. The fact that political action committees and super PACs are telling you that Medicare Advantage is the same thing as Medicare. Let me be clear. Medicare Advantage is not traditional Medicare. Anyone telling you that, it has their own self-interest in mind. If you get a call from a call center telling you Medicare Advantage is the same as Medicare, it's even better. It gives you dental and vision. This is simply a lie. So in order to destroy that lie, you want to ask this question. Okay, so if I change from original Medicare, my red, white, and blue card, to Medicare Advantage, since you're telling me I'm still on Medicare, I'm going to get the same benefits at least. I guess I need to show them my traditional red, white, and blue Medicare card as well as my Advantage Plan insurance card. Is that correct, Mr. Call Center agent? You're going to hear crickets amidst the silence, because once you trade in your original Medicare for an Advantage Plan, you're never going to show your Medicare card to any doctor or provider ever. Why? Because you're no longer on Medicare. You're now at the mercy of a private insurance company. Okay, let me go one step further with this. So this is Medicare. This is the government. Medicare pays insurance companies a set amount per month to manage your care. It's about $1,100 a month. Now, they pay more for sick people. And Medicare pays, let's just say, $1,100 a month for somebody that's healthy every single month to manage your care. Medicare washes their hands clean of you, says, all right, private insurance company, you're going to receive a flat rate for every person that you sign up. And they get bonuses for those with serious health conditions. They get a higher rebate because their medical care typically costs more. So that goes back to upcoding. What do I mean by upcoding? So here is a very quick clip from a former executive at Kaiser Permanente that explains what upcoding is a little better than I can.
You have to differentiate what you're calling billing codes, which is I see you in the office because you have a broken arm, and I fix the broken arm, and I bill for that, as opposed to the way that United Healthcare is being paid by the federal government, which is what the allegations are about, which is specific to Medicare Advantage. There they get paid a set fee. We call it a capitation to take care of a patient, and it's based upon how risky, how likely it is the patient's going to become sick. So if they're adding on diagnoses or they haven't yet manifested in a medical problem, that's okay. If they're adding on diagnoses that didn't exist or exaggerating the diagnoses that do exist, that is not both improper and illegal.
So what the smart insurance companies decided to do, they said, hey, you know what? We can get a lot more money if we say that somebody that maybe is pre-diabetic has diabetes. Somebody with mild exercise-induced asthma has COPD. So what they do is they will fictitiously make up chronically ill diseases so they get paid more. Last year, the estimate was insurance companies made $33 billion with a B, billion dollars doing this. So they're fleecing you and I, the taxpayer, money. Unbeknownst to the client, the patient doesn't even know this is going on. They're not even being treated for diabetes. They're not even on metformin, for God's sakes. So this is the problem is regulatory. If we're going to pay all this money to these private insurance companies, we need to regulate it better. And what are the prospects of better regulation over the next 4 years? We're going to get in that in a second. I get this a lot, though. I'll get folks that will tell me, but Chris, the corporations run business more efficiently, more cost effectively. The whole purpose of Medicare Advantage plans back in the mid-2000s, I think it was 2004, was the advent of the Medicare Advantage plans. The premise was that the government is bloated, there's too much waste, fraud, and abuse. We need to get a privately run corporation to run these companies through managed care, HMO style, PPO, HMO style. It's pretty much the same thing now. It's so expensive to go out of network with a PPO, pay like 40% of the cost. It's higher than original Medicare, for God's sakes. But the whole purpose was this is going to save the Medicare fund. This is going to save Medicare. The reality is, guys, Medicare Advantage plans actually cost the government, Medicare, the Center for Medicare Services, actually cost the taxpayers 22% more per enrollee. So let's just flatten that idea. Corporations have not run Medicare better than the government. They, in fact, cost 22% more per person. And to prove that, let's go over this chart right here. This chart, the American Medical Association, as well as the Physicians for National Health Program. Let's take a look here. So what is overhead? MA plans, Medicare Advantage plans are expensive to operate. Let's take a look. Overhead, the percentage of revenues not spent on medical care. So United Healthcare is at the top. Yay, United Healthcare. They spent 18.5% of the money they get from the taxpayers goes towards non-medical care. Cigna, 18.5%. CVS, 17% of all the money that the taxpayers give them goes towards other stuff, not towards your medical costs. Humana, 14.2%. Blue Cross, 13%. Traditional Medicare is actually 1.8% of the taxpayer money is used towards overhead. The Medicare Advantage plan is the huge, big corporate moneymaker. So what are gross margins? Gross margin is the difference between total premium income plus rebates and the total claims cost per enrollee. Now, while the gross margin does include the administrative cost, the specific amount allocated to the administration cost isn't exactly provided by some of these insurance carriers. But just to understand, you might say, well, hey, they're not making any money. Most of these plans are zero premium. We're going to get that in a second. The real way Medicare Advantage plans make their money are known as rebates, and also what their star rating is will dictate how much money they get in profit. We're going to get that in a second. But all you need to understand is gross margins are what the higher the gross margin, the more money the company's making. And if you look right here, and by the way, in 2023, the gross margins were more like $1,950 per enrollee. That's including administrative costs are in there for most of these carriers. So again, refers to the financial surplus a plan has for each enrollee, calculated between the premium revenue and the total cost of claims, including rebate dollars. Now let's get to rebate dollars in just a second. So one last thing on how Medicare Advantages work and how they make their money and how they're incentivized to keep that money. So the whole process starts with Medicare creating, each year they create an average cost for care for a traditional Medicare enrollee, someone on the red, white, and blue original Medicare card, Part A and Part B. So that's the starting point or the benchmark that Medicare Advantages must compare to. So after the benchmark is determined by Medicare, each Advantage plan submits a bid to Medicare for how much they think they can deliver the same benefits as traditional Medicare. And if they bid below the benchmark, let me repeat, if they bid below the traditional Medicare benchmark, they are allowed to keep 2/3 of the gap in what is called a rebate. CMS gets 1/3 of that rebate. The Advantage plan companies get 2/3. But the Advantage plan is expected to use some of the rebates to either lower their beneficiaries' maximum out-of-pocket costs or provide them with more robust benefits like dental and vision and extra benefits like that. So if the Advantage plan bids above the CMS benchmark, they are required to charge a premium to make up the difference. So now since 2018, if you look here, rebates have doubled. So these plans are incentivized to bid below that benchmark so they can keep a lot of that rebate money. Now they're good at keeping below that benchmark. So you can see since 2018 up to today, they've doubled. Those rebates have doubled. You can see this curve. So what we have to ask ourselves are, what are they using those rebates for? Okay, so we know that Medicare Advantage plans, a lot of the money that they make is the difference between the Medicare benchmark. They come in low on the bid. They get to keep 2/3 of the difference. That's known as the rebate. Troubling, if you look right here, the percentage of Medicare Advantage rebates that are spent on reducing out-of-pocket costs, 2022, only 43% of their rebate was used to lower costs for their enrollees. 2023, that's gone down to 39%. All right, that's the amount that they use towards reducing out-of-pocket costs. And why is that? Well, out-of-pocket expenses are barriers to care. The last barriers induces utilization. If you have lower out-of-pocket costs, folks are going to be able to get that $200 MRI. They're going to be able to go and get outpatient surgery if they lower the out-of-pocket costs. But insurance companies don't want less barriers, so their clients, their enrollees, use the actual plan. They put in more barriers so that they underutilize or they have less care. More profits for Medicare Advantage, worse for people. That's why they're putting a very small amount of their rebate into lowering the out-of-pocket costs. They want things to be pricey. They'd rather have an MRI. MRIs used to be, when I started this business, $50, $100 for an MRI. Now, a lot of these Advantage plans, you're looking at a $400 copay for MRIs. What's even worse, some of these Advantage plans will slide in 20% coinsurance. So God forbid you have to have an outpatient surgery. They're gonna ding you with 20% of who knows what. That's a huge red flag when you're doing a Medicare Advantage plan. You want a copay, not coinsurance. And sadly, there are plans designed where they kind of sell you on the dental and vision. They don't tell you have to pay 20%, just like original Medicare, for some very expensive things like cancer, MRIs, outpatient surgery. So you want a copay, not coinsurance. Okay, so moving on real quick, just kind of a side note here. This is what we got to watch out for these Advantage plans. They get all this money from the rebates, but this is how they're making additional money. This is a chart. Compared to traditional Medicare, Medicare Advantage patients get many more initial home care visits. So we're talking 18.6%. These are of all Medicare Advantage people are getting home visits, nurses that are coming in. And at first, my clients would call me and say, hey, I keep getting calls from Humana, United Healthcare. They want to stop by. They want to do some blood pressure and do some look at my chart. And they said it's going to take about 45 minutes. And early on, I'm like, that's great. They're being preventative. They want to catch it so they don't have to spend so much money if you get sick. I like that strategy. But then this comes out. Medicare Advantage corporations use home visits to find diagnoses for upcoding, but they actually deliver less home health care than original Medicare. So if you look, only about 0.6% of traditional Medicare folks get a nurse that comes in to say, hey, how you doing? Let's check your blood pressure. Let's do this and that. But only 1.6% of Advantage plan folks get ongoing real care. What they're doing is, and this is a great example in the Wall Street Journal, this lady got a call from her Medicare Advantage company. Not only did the nurse stop by her Boston home, they gave her a $50 gift card. And then what they found out was the finding was good news for this lady's insurer, United Healthcare. They diagnosed Lee with diabetic cataracts. That gave the insurance company an extra $2,700 that year. So the more types of it, she didn't even have diabetes, by the way. Her doctor, her own doctor said that later. So the nurse just came in that was hired by United Healthcare to say, yep, give her cataracts, diabetic cataracts. And she got, the insurance company got an extra $2,700. So right here, and this article was written back in 2024, last year, less than a year ago. So if you look here, this says Wall Street Journal. So they get, if you're super healthy, a 72-year-old, estimates are based on a hypothetical 72-year-old Houston man enrolled in Medicare Advantage. This is back in 2022. $3,735 is what Medicare would pay for this healthy person. But wait a minute, if you're obese, you get actually, the insurance company gets $6,100. If you got AFib, you get an extra $2,541. You don't, the insurance company does. You have a stroke, the insurance company gets $2,100. Prostate cancer, $1,400. Chest pain, you get a little chest pain, the insurance company is going to give, Medicare is going to give the insurance company an extra $1,280. So, the fraud isn't really done so much on the side of the government or Medicare or the doctors and providers. What's happening is through these nurse in-home visits, the insurance companies are improperly upcoding or diagnosing their clients with diseases that these people don't even have. The doctor in this particular case had no idea that this lady was diagnosed with diabetic cataracts. And the doctor later said, no, you don't have that. That was a false diagnosis, but the insurance company got whatever it was, $2,700 that year extra. And estimates are $33 billion with a B are being built each year from these Advantage Plan companies through this kind of crap, saying, oh, I get chest pain, this is a heart issue. Well, the insurance company gets another $1,200 for that. You guys get the picture. So back in 2022, I talked about rampant Medicare fraud and abuse back in 2022. And the big thing back then was Medicare Advantage plans are delaying and denying access to care. But they delay and deny access. So think about this for a second. You got to get chemotherapy. You got cancer. 99% of the time, they are going to require a prior authorization. Cancer's cancer. What? No, we're not sure you really need chemo. It's expensive. Acute hospitalization. 98% of the time, if you need to go to the hospital and you're on an Advantage plan, they're going to want a prior authorization. They could deny you. The worst is skilled care. I have had so many clients of mine that really needed skilled care. They had a stroke. They needed to go to skilled care. Skilled care is very expensive for the insurance company. So, and now with original Medicare, I never have anybody get required a prior authorization or ever get a denial if they have to go to skilled care. Your doctor says you need to go to skilled care, you go to skilled care. Now, with these Advantage plans, 98% of the time, they're going to require a prior authorization or deny you. Diagnostic tests, 92% of the time. And then what these prior authorizations do, they're hoping you go away. They're preying on a lot of low income folks, maybe not as educated, and they're going to deny these folks, and then they don't know how to appeal. If they don't have an agent like myself or someone that all they do is Medicare, they hide that in the back of the website so people can't even see it. Comprehensive dental, 87% of the time, they're going to want a prior authorization or they're going to deny it. All right. So what do I mean by, and the problem is now, if you live in a city, there's a robust dental network with a lot of these Advantage Plan insurers. But if you live in a rural area, South Georgia is a good example. United Healthcare had one doctor in a 120-mile area. This is back in 2020, 2021. It's not much better now. Hey, so that's just the reality. Big thing with the Medicare Advantage networks collapsing. There are massive healthcare hospital systems throughout the country that are just, we're not doing it anymore. So let me give you an example of the South Georgia one. Let's look right here. This was Southeast Georgia Health System. What did they say? Unreasonable denials. What did Scripps Hospital say in California? It became a game of delay, deny, and not pay. This is in Stillwater, Oklahoma. This is the Stillwater Medical System. 22% prior authorization denial. 22% prior authorization denial rate for plans compared to 1% denial rate for traditional Medicare. So look, is the future, am I optimistic with this huge pay raise that Trump is giving these insurance companies? Typically when they get that much money injected into the system, you're going to have more robust benefits. I'm guessing the maximum out-of-pocket's going to, right now, for most carriers, it's $9,350, meaning if you get sick, you pay $9,350. That's in network. You out of network, you're going to pay $14,000. All right? So are they, now that's the Medicare. Medicare sets the maximum out-of-pocket. Companies can go lower than that. Insurers try to go lower than that to entice people into their plans. But it should be interesting. In my area, not this year, but the year before, we had a plan that had a $3,500 max out of pocket. I'll tell you, an Advantage plan with a $3,500 max out of pocket in this day and age is tremendous. They had excellent benefits, very low out of pocket costs. Well, they got rid of that plan in 2025, got rid of it, and the plans that were left over were, quite frankly, they just were not good. Very high max out of pocket. It's $9,350. 14,000 out of network, and then a lot of the companies and doctors, MUSC just dropped this particular Advantage Plan insurer. MUSC is a hospital network of doctors, and it's a big hospital in Charleston, South Carolina. They're not taking this particular carrier. So Advantage Plan could be a hero one year, and the following year they're absolute zero. So I'm skeptical of the insurance companies using this newfound money to. This is what it comes down to, guys. If you think that these private insurance companies are going to turn over a new leaf because all the negative bad press, they're going to use more of the money that the taxpayers give them to lower max out-of-pocket costs and give you robust benefits. If you believe in corporations and you think they're going to do the right thing for you, by all means, jump right into a Medicare Advantage Plan. They have yet to prove to me that they are going to do the right thing for my clients. Now, I'll tell you who has to be in a Medicare Advantage Plan. If you're under 65 in most states, you got to get a Medicare Advantage Plan because the supplements are either $1,000 a month or you can't even get a supplement in a lot of states. So I think Advantage Plans are great for people under 65 on disability. I think Advantage Plans are awesome for veterans that have VA benefits that just want an option to see a private doctor or not a VA doctor. They may want to get their outpatient surgery. There's some great veterans plans for folks that get their drugs through the VA, so they can get an MA plan only with no drugs. Because even if you never use the plan and you just love to use the VA, there are veterans plans through USAA, Humana that will give you a rebate of they'll pay $140 of your $185 Part B premium every month. So instead of $185 getting pulled out of your Social Security, some of these veterans plans will pay $140 of your $185 premium. Even if you never use it, that's money coming in that you wouldn't normally have, and they give you dental and vision. So veterans, people on disability, people on Medicaid and Medicare Advantage Plans are great for folks like that. So we know that Medicare Advantage Plans are not traditional Medicare. We understand that there are prior authorizations denials, that it's basically a conflict of interest. You have a private for-profit insurance company. You have a private for-profit insurance company with stockholders, CEOs, and the challenge is, how do we? And these private for-profit companies are being funded by public money, taxpayer money. So I explained the conflict of interest, but let's say that the regulation gets better this year and that Trump is serious about penalizing these companies that are just fleecing the American taxpayer of money through upcoding, through paying off big call centers, through giving doctors kickbacks to upcode, for convincing nurses, in-home nurses, to go into these folks' homes, and rather than provide care, they're looking at their chart and saying, "Oh, you have diabetic cataracts, or you have AIDS, for God's sakes." There's been documentations of that. Even though they're not really treating these people, they don't have these conditions. The Medicare pays them more money for chronic conditions. So, but despite all that, we've decided with all this influx of money, we need to take a close look at Advantage Plans. So let's do that first. So if we look at Advantage Plans, this is a very popular Advantage Plan in my area of Beaufort County, South Carolina. I just went with something I've seen a lot lately, knee replacement. So with an Advantage Plan, you have zero premium. Your worst case scenario, if you look right here, could be $6,700. That's in network. You go outside the network, it's $10,000. All right, so let's just, for easy math, this particular plan has $395. Let's just, most of them are $400 plus or north. I found actually a very good plan for our area for Advantage Plans. Let's just say it's $400 for days 1 through 5. You leave the hospital, you go back, it starts all over again after a 60-day period. So, but let's just say you got a knee replacement ahead. Great thing about Advantage Plans, there's no premium, zero premium. So you go to your specialist says, yeah, let's double check, we'll do an MRI, but you definitely need a knee replacement. You decide to get a second opinion. Doctor's visits are $45. I said $40. Let's just go with $40. So it's $40. You get a second opinion. That's another $40. MRI is $215. I could show you that too. MRI, CT scans, $215. Hospital, they say, all right, we got to get this surgery done. So, knee surgeries, I've seen it, they're in and out that day. Typically, it's 1 to 2 days inpatient. You're in the hospital for a couple of days. I've seen people there as long as 5 days. But let's just average it off. You're in the hospital for 2 days. They want to take the necessary precautions. So you're there for 2 days, and it's $395 a day for days 1 through 5. You're only there 2 days. Let's round it off to $400. So your hospital costs for the year are $800. MRI for the knee replacement surgery is $215. You got a specialist visit. You went to the specialist twice this year. That's $80. And then the big cost was physical therapy, because after you get knee replacement, you're going to be going 2 to 3 times a week getting physical therapy done. And if we look, physical therapy with this plan is $50. Let's say you're in network. It'd be $70 out of network. Physical therapy is $50. So let's say you're going 3 times a week for a month. You'd probably be going more in a month. But that comes out to $600. So your total cost with a 0 premium plan for something as simple as a knee replacement, and I lowballed it, you're looking at $1,695. So let's say you decide to take my advice for a 70-year-old male in our area, Beaufort County. Let's just go with Humana. It's rounded off to $87. So what are your costs for a knee replacement with a supplement? Well, you got $87 a month premium. So that comes out to annually, that's $1,044 in premium. You also have a Part B deductible. It's an annual deductible of $257. So you got to pay that $257 before the supplement and original Medicare, before they start paying, because this is a $257 annual Part B Medicare deductible. So with the plan and supplement, it pays just about everything. The only thing it doesn't pay is a 0 up to but never more than $20 doctor's office copay. So you're going to get $20 for the specialist, same exact procedure, $20 for the second opinion. All right. Now you have to pay that $257 deductible first before anything. So you got to pay the $257. You got to pay $20 for the specialist, $20 for the second opinion. But you've hit your deductible at $257. Your MRI is going to be 0. Your hospital's going to be 0. Your physical therapy is going to be 0. So your total cost for the year is going to be $1,341. So think about it, guys. Yeah, a 0 premium plan is great. You get some free teeth cleanings. Guarantee you with this knee replacement, you're going to have prior authorizations. You're going to have a prior authorization for the MRI. You're going to have a prior authorization. Remember, I showed you 99% of inpatient hospital prior authorizations. Physical therapy, you're probably going to need a prior authorization for that. You might get a couple denials here and there. It's going to delay care. With a plan and Medicare supplement, your doctor says you need a knee replacement surgery, you get it. You need an MRI. Medicare doesn't deny or require prior authorizations for MRIs or knee replacements or physical therapy. So when you do the math, you're going to pay $1,044 in premium. You're going to pay $257 in a Part B deductible. You're going to pay $20 for, and again, it might not be 20, it could be 0. It's between 0 and 20. But see, no MRI costs, no hospital costs, no physical therapy costs. You win. Just for something as simple as a knee replacement, you're going to pay $1,341 with a plan and supplement, and you're going to pay $1,695 with an Advantage plan. It's real simple, guys. You're not going to have to deal with prior authorizations or denials, or you're not going to have to worry about a doctor network. You want to get that replacement done at the Mayo Clinic, by all means, with a plan and Medicare supplement. Go down and get the best care at the Mayo Clinic if that's what you want to do. All right, you can go to any doctor in the country with a plan N that accepts Medicare. All right, with an Advantage plan, you're going to go to the local hospital with a local doctor. You're going to get it done. They're going to give you all kinds of problems with prior authorizations. You know it's going to happen. I showed you the statistics on it earlier. So what I would highly recommend, if you don't live in a state where there's guaranteed issue rights, or you have a birthday rule where the premiums have gone up quite a bit. If you live in places like South Carolina, Georgia, North Carolina, South Carolina, Georgia, most states, you're going to get a great Medicare supplement rate if you work with an agent like me that's licensed with all these companies. All right. What I want you to do right now, you can go to supplementquote.com, like Medicare supplement, but it's supplementquote.com, or mayrivermedicare.com. So what supplementquote.com does, or mayrivermedicare.com, on the home page, on the front page, you're going to see a quote engine, a tool. It's going to say, compare all plans. And what I mean by all is every single carrier that offers a Medicare supplement in your county. It's based on your zip code, your date of birth, two most important factors. And then you're just going to type in your gender and whether you smoke tobacco, do tobacco or not. The quote tool needs that little bit of information to generate all quotes in your county, in your area, because that's what it's based on.